You only have to be a primary care provider for one day to know that your physical health and mental health are inextricably linked. A lot of people say the majority of primary care is mental health related. I would go further. I'd say 100% of primary care is mental health related. No matter what you're seeing in the clinic, no matter what that chief complaint is, the patient's ability to deal with it and get better is going to be dictated by their mental health. One of the things that was most evident about the health system is the fragmentation of it and the divided and siloed care and the way that that affects the patient.
When the medical team and the behavioral health services are not together, we might not even target the needs. Maybe that patient is having a depression and that's why she's not adhering to the treatment.
Integrating behavioral health into medical care truly elevates the standard of care. When you're in that clinic room, you're trying to figure out what you can do that day. And as a primary care physician, we don't have a lot of time. And when a lot of those things you realize actually are probably mental health related, it's literally a walk down the hall or a click of a button to send a message to our behavioral health team.
As a behavioral health provider, when I go to that room, I am able to listen to that patient. We ask about family, social relations, emotions, and our behaviors at home. Those will impact our health. So I am able to go back to that medical provider and say, this is why she's not taking the medication. This is why she's not coming to the appointments. Hey, this patient might benefit from practice some relaxation exercises. We can also address nutrition.
For me, I'm not just dispensing a medication to make this patient better, but we're actually looking at the whole picture. Because when you truly treat the whole patient, you have better outcomes. You have better mental health outcomes. You have better medical outcomes. You instantly see an elevation of not only the individual, but as a community.
The patients usually are very grateful that we can work hand by hand with their medical provider and that we work as a team. Providing behavioral health services in an integrated care setting, we prevent other conditions to develop. We reduce costs and we have better outcomes in a timely manner.
I want to see people happy. I want to see people mentally healthy. As a primary care physician, you are always asking yourself, have you done everything you could for these patients today? And I can honestly say, working in an integrated care model with behavioral health, I know that I have.
Even though you're taught that you shouldn't take your patients with you in mind to your house, but it's inevitable. You're human and you touch a lot of life.